All right, Dr. Kelsey Beach, hello. Welcome to the Perinatal
Hi,
Podcast. Hi, how are you today?
I'm doing well. How are you?
I'm enjoying this sunshine. It was a little rainy
And
and
like
cold
this
over the
cool
weekend.
weather, this crisp 80 degrees.
It's like sweater weather for us. What are
I
you talking
know.
about?
I
We're
literally
long
was like, do
sleeves.
I wear pants and a hoodie today?
Yes. Well, we were in Chicago this past weekend, and literally when we looked at the weather, so one of my girlfriends on the panel with me she's from Florida, and one is
Hmm.
from Texas. And so we were like, 80? Oh my gosh. It's like pack my sweaters and my cute jackets. I love it.
It's pumpkin spice latte season.
I never got into the pumpkin spice
I
latte,
don't either. I
but I'm
do love
excited for
pumpkin
other
flavor, but
people.
I'm not like, I don't go all out for them.
Yeah, I'm excited for other people. People get really excited and have like specific coffee mugs for them dedicated and whatnot. So,
Really?
all right. So I always like to start off with how do we know each other?
Hmm. So we connected first through Instagram,
Yes.
which
Yes.
is pretty much every connection I have in Kansas City is through
Perfect.
IG. Like I am notorious for sliding into DMs.
Me too. Me
My
too.
best marketing tactic.
And I don't even have you been to a training or a happy hour with a perinatal group here, or are we
I have
literally
not. No,
we've
I
never
have
shared
not yet.
oxygen?
You've been to the fourth trimester happy hour, which I usually host with Oh Baby
Yes.
Casey and Lisa Votter. Mm-hmm.
Yes. Yes. Okay. I was like, I thought I saw you there
Mm-hmm.
anyway. Yes. But we've been talking so long that I feel like that's the
I
beauty
know.
of post quarantine, I guess, is that you feel these connections with people in meaningful ways, even though like I said, we've never shared oxygen before. So
Exactly. But we've shared so many keyboard screens.
so many keyboard screens.
Mm-hmm. Mm-hmm.
Wonderful. Well, thank you so much for the time. For the Kansas City area, of course, but just again, I'm just so excited to share the message for people in the perinatal spaces. Like mental health is certainly becoming more known. So many other things are being known, like, oh, I could go to a physical therapist related
Yes.
to my issues. So
Mm-hmm.
thank you so much
Mm-hmm.
for
Of
taking the time to share your journey and your
course.
services. So how did you
Of
decide to get
course.
into physical therapy?
So long journey. I came from a very athletic family who had had multiple surgeries throughout their youth.
Uh-huh.
My first knee surgery when I was 14. By that time, my sister already had like three knee surgeries. My dad had had one. My mom had a couple shoulder surgeries. So we had just been in and out of rehab PT. And I kind of was like, I like this. I don't mind this. My father was like, you should not do this. This does not pay well. And so I kind of had these like, is this what I want to do? My dad doesn't really approve. Like,
Yeah.
and then more and more, like as I got older and then into college, I was just like, this is what I want to do. Like ever since I was 14, it was what I thought I wanted to do. And I knew I wanted to do it then and decided to major in it. Go to PT school. My first day of PT school, I was like, man, I'm going to be the best sports orthopedic
Mm-hmm.
PT that's like the Kansas City Chiefs have ever seen. Like this
Yes.
was my goal. I was like, I'm going to be the best. Started learning about outpatient orthopedics. I was like, this is boring. Like this is so incredibly boring. I have zero passion for this. Um, so then I pivot shifted a little bit and started doing a lot of my education in pregnancy and physical therapy. And I thought, oh, well, this is kind of interesting and different. And one of my presentations I had to do projects was I built a whole course or education platform for the women in my community through the hospital. And I
Mm-hmm.
remember I went to do it and they were all pregnant women. I was like, who has heard of your pelvic floor? And like no one raised their hand. Granted, it's like
Yeah.
small Missouri. This is 13 years ago ish. But I thought, whoa, no one knows about this. So that's kind of where it like opened my eyes of like, oh my gosh, this is just a demographic that's not being served. We're not talking about the pelvic floor. We're not doing anything. So yeah, so I was the first person from my school to do a women's health pelvic floor clinical. And I went to a small Baptist school. They were like, we don't even know what to do with you. You're going to have to like find where to go. Like this is, you're so beyond our scope. So yeah,
Wow.
I was the first one from my school to do a full pelvic clinical.
Mm-hmm.
And yeah, went and did it and just have never looked back. So I've been a pelvic PT since I graduated,
Wow.
which was over 12 years ago, which was not the norm. Most people had decided to go one route of like general PT, and then after a few years ended up specializing in pelvic, but I've only ever done pelvic rehab. That is all I've done. And so yeah, so then
Wow.
here I am.
I
Mhm.
mean, that's so interesting. Just moment for the Chiefs though, because like that literally has been and still kind of is like my dream to just maybe get a PhD and be the team doctor for
Yeah, that
like
was
in charge of the mental health program for a professional sporting team.
that I was like, yeah,
Yeah.
no doubt, like I'm going to be the best. But I do think I think the physical therapist that rehab Patrick Mahomes' ankle is a woman. And I
Did you
think
watch Quarterbacks? I think it's on
I
Netflix.
we lost our Netflix privileges because password sharing.
Boo. Boo. I mean,
Right.
we could go off on a whole tangent there, but yeah, well, that's if you get an opportunity to see it, it's really, really interesting. And they do talk a lot about the different things that they all do. I mean, there's a woman as well who
Mhm.
does Kirk Cousins, comes to his house, does a whole shebang on him. Like, I wish that I had the financial resources to have somebody, again, I don't put my body through what they put their body through, but I wish I had the financial resources to have somebody come and take care of my whole being physically
Yes.
in such
100%.
an intentional way. Like
Mhm.
I really would. I recently had been going to a chiropractor for, I think I went probably about 8 weeks or so. I get 20 a year. So I was like, I'm gonna do
Mhm.
8 now, or how many did I do? It doesn't matter, but I did a number of weeks in a row. And it was just nice to, I'd walk in, as you mentioned yourself, I have a number of I have a history of injury and participating with physical
Mhm.
therapists. And somebody's like, what
Mhm.
are we working on today? I'm like, oh, it's the knee today. It's the lower back today. It's the upper back today. It's, yeah.
Nice.
Yeah. So I watching that on Quarterbacks, I was like, man, I wish we had more access to such things for sure.
I know why PT does not give me $50 million a year. I don't know, but
Shockingly.
I know one of
Yeah.
these days, maybe.
Yeah. And that's so interesting. I love that you got into perinatal that way. And it's so interesting. Like I have this conversation so much on this show. We are not educated on things like pelvic floor. What's a pelvic floor? Even when you I suppose if you took an anatomy and physiology course, but even then, unless it was specific to perinatal needs or
Mhm.
obstetrics, you
Mhm.
probably
No,
mentioned it once, glossed over, and moved on.
I think we talked about it 10 minutes in my anatomy class, in my A&P class in
Yeah.
PT school. They were just like, oh, there's a pelvic floor. Bye.
Okay.
Not
Bye.
what we do. I know it's changed a lot though. I know PT schools are even offering women's health and pelvic PT electives, if
Mhm.
not full on part of the curriculum. So it's definitely changing. We're seeing
Okay.
the speed of this completely change to when I started so long ago.
Oh, that's good to hear. I like that there is at
Mhm.
least, and I say that
Mhm.
intentionally, at least
A little bit.
at least an elective option. But yes, and it should be something too that we are educated on as humans with pelvis. When
Agreed.
we're in the right, like who's teaching us to do our taxes in the United States? Who's teaching, like, why don't we learn foreign languages at a younger age? Like all of these
No,
things that
I
are
know.
not
I know. I know.
happening.
I know.
Yeah. So I'm so that's again, that's why we're here, is to be able to have these conversations and let people know like what's a pelvic floor and why am I peeing all over myself and what am I supposed to do about that after I've given birth?
Exactly.
And yeah,
Exactly. 100%.
yeah, absolutely. And so I know a lot of the reels that you do, which I love, are you talking about like the different labor and birthing positions from a physical therapy
Mhm.
perspective and like pros and cons? I was wondering because these are not honestly, and I loved my obstetricians, both of them. And the first one, she was a little more old school, and I didn't learn anything. It was basically
Yep.
like, "Oh, you want an epidural? Cool. I'll see you there
Mhm.
on the day." We didn't talk at
Mhm.
all about like breathing through the pain
Mhm.
until I got the epidural. We didn't talk about now, of course, the nursing staff came in when my labor stalled to like put the peanut between my knees and lay
Yep.
sideways and knock down part of the bed and all of the different things. But again, not things that necessarily people were prepped on. So I was just curious if you could share some of your expertise on that.
Yeah. So kind of going back to PT school when I talked about how I started in doing that pregnancy
Mhm.
course. So my whole career outside of that was not perinatal. I
Mhm.
thought perinatal was the most boring thing to treat. it like a pregnant woman came in, I was like, oh, you're just pregnant. Like,
Yeah.
that's
Well, you
it.
can't
Do these,
snap on her and
do these like few exercises, have the baby, you'll be fine.
yeah.
My like bread and butter, my career was actually in like high chronic pain and bowel
Mhm.
dysfunction with a little bit of pediatrics. So I
Huh.
lived in like this totally different layer than where I live now. So I didn't get into perinatal until I decided to start my business because I was pregnant. And same thing. Um, no one was educating me.
Yeah.
No one was giving me education on what my body was going to go through during pregnancy, how I could utilize my body and my biomechanics during birth, and then what my postpartum healing looks like.
Mhm.
So my expertise really came about um, through my own journey. And then like I said, I just totally pivot shifted. All my education became about birth biomechanics, and the
Mhm.
pregnant body and the postpartum body. Because yeah, and the way I describe it, your OB catches your baby. That is their job.
Yes.
As long as that baby comes out, like you get stitched up, healed up, whatever you need, like they did amazing. Their job is not to educate you on the pelvic floor. And I think that's where we get really kind of lost in like the translation of who's responsible for what. Like we
Sure.
cannot count on our OBs to do this. Like I don't take my car to get the oil changed and also ask them to do like, can you also go ahead and clean the whole entire interior? Like it's not their
Right.
job. And so I
I
think,
love
and
that
that's,
analogy.
yeah. And I think like
Yeah.
my OB, that's their job. Like I did midwife birth and an OB birth. They did their job. My baby came out.
Mhm.
It ends there. And so
Yeah.
we're getting like so pissed at like, well, why did my OB not do this? I'm like, it's not their job. Like,
Mhm.
so we need to change the narrative of saying, well, whose job is this? And that's where PTs really stepped up, especially in the last couple
Mm.
years in the birth world, to be like, oh, this is our job. Like,
Yeah.
we are the biomechanics nerds. Like,
Well,
we are
right.
the nerds that know if you move your hip in external rotation, opens the top of the pelvis to help the baby engage a little bit
Mhm.
more in the earlier stages of labor
Yeah. But I would
versus
not to like continue to point the finger of blame, just there should be no blame. I'm just saying like I wish somebody then would have been like, and now we're going to refer you to a physical therapist who's going to teach you about birthing, labors, and positions. But this is something I didn't specialize in perinatal for either of my children.
Mhm.
And I didn't know what I didn't know. I didn't know to ask. I was just like,
Exactly.
okay, well, I was like, well, they'll walk me through it on the day, and
Yeah.
there's no
But then
PT on staff.
same thing comes back to the car. Like if I go get my oil changed, they're not going to be like, hey, I noticed your car's really dirty. You should go to this
Yes,
place. Like,
yes,
and
yes.
it falls back like I quit counting. And honestly, I quit marketing to OB groups because they are doing their job
Hmm.
and birth is a business. Like they are busy. And so
Yes,
I
well,
think
that's
it
very true.
falls back like, honestly, it falls back on us PTs to say, here's the information you need. Here's why you need us. Like I'm standing at the car wash with my sign that's like, let me wash your car. And I don't want to point any more blame.
Yeah.
Like it
And blame's
comes
a
back to
terrible word to use, right? Like,
it is, but I also like it. Like,
yeah,
but if you would have asked me that question a year or two ago, I probably would be like, yeah, it's the OB's fault that they're not referring. It's
yeah.
not. But
Hmm.
we're also now in a totally different model of PT where we have direct access. You can come see us without a referral. We're stepping
Yeah.
up and saying, hey, we're the experts in this actually.
Yes.
And that's where we've changed. And we're no longer saying like, oh, it's your OB should have referred you. Like, no, we as a society need to talk about these issues
That
more
one. Yes.
to
That
say like, oh,
one.
I dealt with this too. I went to this great PT. Or hey, I was scrolling Instagram and I saw this amazing reel from a PT about birth. I had no idea. Like we have to change the narrative for saying this information's out there. We just need to now make it more readily available.
Yeah. No, I hear you. I love that. And again, it goes back to like, why are we not teaching Spanish in kindergarten, and who's teaching us
Yeah.
how to do taxes? And it's the
Yeah.
things that we don't know that we don't know. Um,
Agreed.
and yeah, I mean, it's funny. I was with my parents this weekend, and my birth story came up and like trying to process some of my own birth trauma. And it's like, you can't know what you can't know, and you can't go
Yep.
back and change time and
Yep.
anything, but it is always interesting. And it's nice for me to be able to feel like I hope to be able to help encourage people to ask questions,
Yes.
to feel empowered. Like, what else don't I know? Who else should I be seeing? What else do you think? And then these are the conversations that we're having now that people are listening and they're like, oh, okay.
Oh, that light bulb goes off. It's like, oh yeah, you're right. And even between like my first and second birth, like my first birth, I didn't know what I didn't know. And now that I know this, I mean, over 2 years later for my second birth, it was totally different. Like, and even being a pelvic PT in this world, it's always changing and evolving. The education's out there. It's just, it's now our responsibility to share it on as many platforms as we can, so that more moms can be like, oh, I can get access to this. I do know what this looks like now. And now I know where to go for it.
Yeah. I love that. That's wonderful. And so I was wondering, like, are you familiar at all with like standing and crouching and positions, and what can you do when you have an epidural, and what can you do when you don't? And like, what does that all look like?
That is my burning passion. Like, if I had one passion in PT right now, like if I could pick the one patient I want to see for the rest of my career,
go ahead.
It would be moms like in the third trimester getting ready for birth. Like, I only want to see birth patients. Like, that is just where my burning passion is right now, because there's so much about the pelvis and the muscles and the structures of it that can assist in labor and delivery. So yeah, my whole, and I'm here for everyone's birth. Like, if you were like, my favorite birth is a scheduled C-section at 3:00 on Thursday with as many drugs as I can have, I'm like, girl, yes.
Shut it down. Let's go.
You know what you want. Or if you're like, I'm birthing in the backyard with 6 deer and like no one present.
Yeah. Great.
Also like, let's do it. So my kind of favorite thing is to teach women is just, so when I take a mom through birth prep, we're talking about your breathing mechanics and your pushing mechanics. We are not taught how to push babies out. Like, and anyone that's like, oh, it's just your body knows how to do it. Like, it does not. Like, your first time labor, like your body has no idea what it's doing.
Yeah.
And so I love to talk about your breathing mechanics, your pushing mechanics, and then how those two work together, using them at different stages of your birth. And then we get into positioning. Like, birth positions are one of my favorite things. Because no one knows they have an option. You know, when I see our hospital-based birthers, which I love, I was a hospital-based birther, but you're just taught, like, what I always go back to is we're taught that like you were the Rachel in that Friends episode. Your knees up, you're screaming and you're cursing, what's his name, Ross, that like, this is all his fault. Like, that is our idea of birth.
If you do not mind a quick 20-second tangent, have always wondered, they went through such great lengths in Friends to show that people can have babies and not be married, that people can do IVF. Although interesting, I don't think that it wasn't, never mind. Anyway, gestational surrogates just became legal in New York, but it was Frank and Alice's egg and sperm. So never mind, apologies for that. But anyway, that you can carry for somebody else, and that you but none of them had an epidural. I was like, y'all put so much time to show how families and babies and everything is beautiful, and then adoption with Monica and Chandler. But no, and then Anna Faris didn't have an epidural. Like, no one had an epidural in that show. And I was like, who made this choice?
Yeah.
Who? Yeah. Of the 4 births?
That's a great question.
Why?
I know.
There's Ben, and then the triplets, and then Emma, and then the twins. So I'm not doing that math right now. Somebody else count for me. But yes. But yeah,
we have an idea of Hollywood-based birth.
Yes.
On your back, that semi-reclined, knees to your chest, holding your breath. That is all we know. And going back to, you only know what you know. Yeah. And we don't know how to birth. And so I love talking to moms and just saying, like, you have a plethora of positions. Like, so in my clinic, we usually go through about 10 of them. And I still encourage, like, this is like, we need to figure out what laying on your back looks like. Like, it's a semi-reclined, semi-Fowler position. Like, we need to feel like you need to know what this feels like too, because you might like it. I have a lot of moms that are like, dude, that was just where I was more comfortable. I'm like, perfect.
Then
Like,
do that.
yep,
Yeah.
there's nothing wrong with birthing on your back. Like if I post that on social media, I'm going to get a fire hose of negative comments and feedback from it that I support the non-physiological birth. Like some people physiologically function better in that position. But
Sure.
yeah, if you were to ask me my favorite position, I'm a all fours leaning over the bed. Like that to me is just, it is powerful. It is gravity assisted. It's epidural safe. Like that is where my passion is. And I wanted to do that with my first son and I didn't. But my second son, I had the most beautiful all fours, full epidural in that hospital bed, breathe that baby down, push that baby out in like 2 or 3 pushes. It was amazing.
Nice. Yeah.
But yeah, so many moms just don't know they can do that. And so I love just giving them this huge toolkit that says, take this to your provider, say, I've been working on these positions. I feel really comfortable. I feel really confident in all fours, in chair position, in a deep squat. Like, can I do these? Like, take it to your provider and just have this beautiful open conversation, like work as a team. Because the thing is too, they're going to show up that day and be like, this is what we're doing. Like, you're going to get on your back. Maybe you're stalling a little bit. Let's throw a peanut ball in there. They're going to do what works. Like there's a reason we deem it like the old way of pushing. There's a reason that hasn't changed. It gets babies out. Like it's been getting babies out for years, but I love just empowering these moms with this plush toolkit of different breathing, different pushing, different positions, different mechanics, different tools, like peanut balls, squat balls. Like I love a pool noodle. That's one of my favorite birth tools right now.
Oh, I remember that one. Yes, I was like,
I love that one. Yeah. I love that. Like just there's so much you can do for birth that allows you to narrate the story yourself instead of having someone else narrate it for you.
Yeah.
So that is where my like burning passion is. I'm actually getting ready. I think in October, I'm taking a 5-month training on birth biomechanics.
Yeah.
I think I will be the only physical therapist in Kansas City, if not like the region, that's going to have this training.
Yeah.
Really excited for it.
Wow. That's so exciting. And 5 months, really in depth.
Yes, it is. So I'm hoping I can keep up, but I'm so excited for it. The gal that's teaching it, she's a doula. I don't know where she's at. I feel like New York maybe, but she is just, a brilliant mind of biomechanics and how your body can move to better assist your birth. Like, and it's just so cool. And there's so many options. So I'm really looking forward to it.
Yeah. Yeah. Well, that sounds just wonderful. And again, the more people that we have that we know we can ask these questions to and set up for success, the better. And obviously here in the Kansas City area, but also for those of you who are listening to be able to say, like, go out and Google in your own area and find that out somewhere who's available around you. It can be so.
Exactly. Agreed. And my goal is virtual PT is a really weird thing to me. Like I'm a true believer, like there's a reason it's called physical therapist because we physically need to be touching you. It's such a thing. But I think like with birth, what I've kind of learned, there is a lot that we can also do virtually because it's not as much hands-on work. So I'm really kind of hoping to even build, after I go through this training, build some courses, build a little bit of my own spin on the course to talk about how I teach birth prep so I can just reach more community members to help assist with their birth stories.
I really do love that. And I hear what you're saying too. I've always been curious about that, like, especially during quarantine, about like, what do people do who have jobs that require the physical piece of
physicality. Yeah.
And so what are some common struggles that you have noticed in working with your population? What are some things that you kind of recognize that people run into these common issues, or just generally, what do you think are some common struggles?
I think a common issue is not knowing we're available. What I see, and I talked to a lot of other providers about this, like in the perinatal space, we talk a lot about you need a village. You need a village, you need a village, you need a village, you need
Yes,
a village.
yes.
Villages are expensive. Like, I think a big barrier to women getting care is cost.
Yes.
And majority of the village is out network as well.
Yes.
Like, because insurance does not want to pay for what we're providing. So we've gone more out of network. So I think a big barrier is financial burden of what we provide. Your village deciding how many village members you want to see at a time. I was talking to another chiropractor about this. She's like, I'm referring so many people your way, but a lot of my moms are like, I can only handle one provider at a time right now. Like, I'm at home with 1 kid, 2 kids, 12 kids. Like, I can only handle that.
Yeah.
And so I've learned that.
Yeah.
And then coming to appointments with kids, it's hard. We tell all of our moms, like, bring your baby. I can't tell you how much snacks we vacuumed up because we want moms not to feel like they can't come to PT because they couldn't get childcare. Like, bring your baby.
Yes.
And so we're big on that as well. And then we're rolling out our postpartum group. So we're going to roll out a new postpartum group it's going to be a 6-week group to make PT a lot more accessible and affordable. So we're doing a heavily discounted 6-week program for postpartum moms to make it more accessible, more affordable, and then help build more community. So it'll be 5 women with one of our therapists. And then we're also going to try to have like sponsors come in. So, perinatal health therapists come in, bring some coffee, bring some treats, and bring all your marketing material, your knowledge to let women know, like, hey, you don't have to go through this alone.
Yes. Which is why I love what you put on with the 4th trimester happy hour and everything, because it's just so nice for all of us to be able to, when I'm talking to a client and I can immediately say, oh, have you heard of Dr. Beach? Oh, have you heard of, it's just really very helpful to be able to have those conversations and know the other things that are available out there.
Agreed. 100%.
Yeah. Yeah, absolutely. So I remember, talking kind of about some of the things that were struggles that we've noticed. One of the other things that we talked about, I made a reel, gosh, it feels like it was months ago now, but I think it was like a week and a half ago.
That's the Instagram world.
That's absolutely correct. And I have to admit, gosh, I wouldn't know you. I wouldn't know so many people. I wouldn't know half, if not more, of the guests that I have on my show, if not for Instagram or people who've introduced me to people, but I met the first one on Instagram. It's so much work and brain energy, and it's not something I find myself to be terribly naturally creative at. But anyway, this is something interesting. Like, when was that? I can't remember, but we talked about in my reel, I said, because I'd been talking to a lot of clients about that vision of perfection, like my ideal situation, activity planning, scheduling, movement, all of that. And it's like, ideally, I'd like to work out 45 minutes every single day or 5 or 6 days a week. And I didn't get to. So, and I like this too. One of my students she either coined the phrase or she at least introduced me to it. I hadn't heard it before. Not living in the might as wells. Like, I don't have time to do the 40. I know, right? I don't have 45 minutes. So I might as well not work out at all. I had a piece of cake at a birthday party, so I might as well have 3 pieces of pizza. Not living in the might as wells. For my reel was, I was hoping to paint all of the chips in my walls from having children. But I felt pretty confident that I would not make the time to do that. So instead of might as well not do it at all, I was like, but I can find the paint. And so that's what I went and did I went down where the paint was so that I could set myself up for future success to know, like, next time I'm going to go straight here and pick up the paint and go. I didn't have 45 minutes to work out, and I could have said, well, I might as well just skip it entirely. But I was like, but I have 15. So I'm going to go work out for 15 minutes. And I know you were like, oh my gosh, yes.
This is what this is a huge barrier, is so many women are like, I don't have the time to dedicate to myself. I don't have the time to do 6 weeks of PT. I don't have the time to do this at home. And we tell so many of our moms, like, the goals in rehab are made at home. But 5 minutes of movement, 5 minutes of intentional, like, pelvic floor postpartum birth, like whatever we want to deem it, like 5 minutes is amazing. Like, even if you just sit down and think, what's my pelvic floor doing? That's
Yeah.
more than you may have just done the day before. And
Yeah.
so we tell like, yeah, I love not living. Well, I might as well just not do it. Like, I am not naive to the fact that the mom life is so
It's so hard.
busy. Like,
Mm-hmm.
even today, I'm like, oh my gosh, can my kids stay at daycare till just tomorrow? Like,
Yeah.
I've so much, like, how is the day almost already done?
Literally.
And it's just, I loved that reel because it hit so hard to the heart of all moms of like, oh, I don't have time to do that. I might as well just not do it. Like, that's what we see is like, I just might as well not do it.
Yeah.
And so much like all of us clinicians in my clinic, like, we're all moms. We're all moms of at least, I mean, I've got, all of us have 1 to 2 kids and they're all little. And so we get it. And so we can empathize and we can say like, if you even just stopped and thought about it, like, you did amazing. You did such amazing work that day, and applaud yourself for it. Because then, if you knew that you can just intentionally sit down and think about your pelvic floor for 30 seconds, if you can do that every day, then that's going to turn into a minute. Then that's going to turn into 3 minutes. Then that's going to turn into 4 minutes to 12 minutes. The next thing you know, you're like, oh my gosh, this feels so good. I've now figured out in my schedule how to set that time aside to let it like slowly build. And build and build and build. And then there's also days I'm like, if you don't want to do it, don't do it. Like, big deal. You're not setting yourself back. I mean, if you don't hit a 45-minute workout, guess what? You're still going to be fine. Like, 5 minutes of intentional movement, breathing, whatever is just so powerful. And that was a hard pill for me to swallow. Like, I come from a very athletic, like, triathlete background.
Yes.
So workouts to me are at minimum an hour, if not, like, I remember when I was training, like, I would go out for a 6-hour workout. Like, that was normal.
Yes.
And now, like, if I steal 1 hour, I try, like, my husband and I have it figured out. I steal 1 hour Saturday and 1 to 2 hours Sunday. And sometimes that's it, but it's just so powerful to me. And it took us a while to get there.
That's the thing too, is like you said, it took us a while to get there, to be able to go from where you were to doing, I don't want to say nothing because you're doing so many things, but not what you were doing before having the baby. And then trying to get into some sort of homeostasis, back into creating some sort of new normal is very difficult. And it took my husband and I a really long time, especially because we moved here with an 8-month-old baby in March of 2020, quarantine baby life. Like, we just do everything together all the time, which is really lovely. And I'm really grateful for the time. And I remember one day he looked at me and he was like, why don't you go ride on the Peloton for like 20 minutes? And I was like, just Saturday morning, we're sitting watching Turning Red for the 800th time. And I was like, that's a great idea. Then I'll shower and then you can go run on the Peloton for 20, like,
Yep.
And ideally would be able to go to the gym for 2 hours and take a class and stretch and blah, blah, blah.
Exactly.
And it's just being able to find those pockets of time. And if you've never even focused on your pelvic floor at all, 30 seconds is a big deal.
It's huge. Like, that's amazing. Or like with my birth moms, I'm like, if you just think for like, what do you want the lighting to look like that day? Like, that's a huge tool in your toolkit. And then just those small things just build and they build and they build and they build. And then before you know it, you have intentionally put yourself a little bit more in the forefront as opposed to the back burner where so many moms live. And I think it's powerful. I mean, my journey to get to this like level of working out has taken 2.5 years. Like, not even, I had no idea how to take care of myself after my first son. Like, no idea. And then my other son's 3.5 months, and I'm so comfortable now just being like, I'm out, bye. Like,
it's so true. And I hope that everyone is interpreting that, but I will explicitly say what we are implicitly expressing is that it's not I listened to this podcast and now I'm going to take all the time for myself. It really is an evolution. It is such a strange thing to be only in charge of yourself, to being in charge of a tiny human that absolutely cannot live without you. And we are, and I'm going to use the word mom intentionally here, but I don't use it myself. It's parent guilt, because it should not be specific to birthing parents. It default caregivers. Everyone needs to, but we're told like, you need to make your whole life about your child. And I really do encourage people, like, if your children want to have children, how would you want them taking care of themselves as a parent? If you
Yes.
start modeling that for them, if they recognize like, okay, dad's gonna take us on a walk and mom's gonna go for a run. And then halfway through, mom's gonna come back and take us for the walk and dad's gonna take off on a run. Like, or whatever. I don't know. That just came to my mind. We don't do that. We probably should start doing that. Actually, it's a good
That's
idea.
a great idea. I was like, we don't do that either.
Actually. I'm gonna hang on to that until my
Uh-huh.
gracious Austin listens to every one of his episodes. So I'll tell him before I post it, but that's a good idea. Anyway, your children will see that you prioritize yourself, and that will implicitly, or if you have this conversation with them, give them permission to start doing that already. And then
Yeah.
especially as they become parents themselves, should they decide that they want to have kids.
Agreed. And I think another thing too, like, especially in the child rearing words, like we're like, kids need to learn how to independent play. Kids need to learn how to independent play. Why are we not why are we not encouraging parents to independent play?
I don't know the answer to that. We need to.
Right? I mean, because that kind of goes, no, because I just thought of that. But that goes along to what you were saying, why are we encouraging parents to be like, you still have to independently do this? And one thing, I made a social media post the other day about, so there's a big thing going on right now about, the American College of Pediatrics just said the fitness, like now it was like the mother's fitness levels has a direct correlation to your child's fitness level. So it was really big on like encouraging, like, you need to work out in front of your kids. You need to work out, like, you need to make sure your kids are seeing that. And I was kind of like, dude, fuck that. Like, I want to go to this for myself. Like I think it's really important that my kids see me be active and be like a strong, influential, just functioning member of society. But like, I also want to work out to regain like the identity of who I was before I had kids.
All of that is so true. Like, there are pieces of our identity that will never be the same. There are pieces of our identity that we won't get back in certain ways, and that's great, and that's okay. But we also grieve the loss of it, because that's okay too. And I talk about that a lot. I'm a social worker, right? So we talk about people in environments, and so whatever you do, you don't do in a vacuum. Other people are aware of what's going on. And so while it's really nice, if that's something that motivates you, is that other people, like your children, will witness you doing that, that's great.
Awesome. I love that.
That's great. And also, I mean, yes, implicitly, and now here I'm saying it out loud, is that we want you to be able to be in a space where you feel confident that your needs are also important. And we don't really do a good job of that. It takes a village thing, but think about what we get in that, cursory, the baby gets seen, within the first week, and then every week, and this and this and this and that. And in the United States, I know some people, my listeners in other countries, are like, wait, what? You don't get seen for 6 weeks, and you get seen once. And while your baby's on your boob, they ask you if you want an IUD or whatever sort of birth control you want. And then they send you on your way. And unless there was some sort of complication, which hoping that's not your case. And so we're told by the system that we are less important. So we're just claiming that here.
Thrown to the back burner. Like that's it. And I think, I love my kids. I love being a mom, and I cannot wait to show them just how to live like active, enriched lives. But I also need to show my kids, kind of like what you were saying, Meg, is like that your needs matter too. And if that means taking time for yourself, like, I want to encourage that. And that's modeling. I mean, we have to model everything for our children. And so if that's taking 5 minutes for yourself as a mom, just to be like, my intentional pelvic floor work might just be sitting alone outside for 3 minutes today.
Yes. Take your 3 minutes, team. Take them.
Take it.
Yeah.
And so, like bringing in the horses, the reel that you made just really struck to me, because our rehab does not have to be all consuming. Coming to rehab, staying in rehab, continuing doing rehab, it does not have to be this commitment of like time warp suck. I've been in clinics where we push that on patients. It's like, no, you have to see us once a week.
Yes.
For 12 weeks. Like, that is the only way you're going to get better. And what we really encourage with our patients at enCORE is like, we do want to see you a little bit more of, and like the front end. So it might be every week for like 4 weeks, but then after that, like we said, like the gains get made at home. And so it's us assisting you in building your toolkit that you can access these tools at home, because once you're postpartum, you're always postpartum.
That's
You
right.
might have an issue come up 6 years down the road. And our whole goal is that you feel so confident in the journey that you took with us, that you can get this toolkit out, sort through it, and be like, oh, I need to go back to foundational work of breathing, of pelvic floor work, and then I can advance off of it. But it takes time. It's that evolution, like we both mentioned, that it's such a marathon, not a sprint.
Yeah. Yes, absolutely. I love that too. I actually wrote it down, bringing in the horses.
Yes. I got that from Lisa Vaughter, chiropractor. Like, I remember she said that
She's
one
been
time,
on the show.
that has stuck with me. She's bringing in the horses and noodle on it. Let's noodle on it for a minute.
Noodle
So
on it.
those are her 2 things that I have taken away from her.
Well, I don't know the number off the top of my head, but everyone go and listen to Dr. Vaughter's podcast episode as well, because she was on here talking about perinatal chiropractic. So that's great. Well, wonderful. So thank you again for so much for coming in and talking about this. And the whole point of the show is just, I love to talk to people who know things that I don't know. I'm continuing to learn every day, and I'm in the business, I'm in the area, and I'm so excited for my listeners to be able to be like, oh, didn't know that was an option. Right. So I really appreciate that. Where can everybody find you?
So you can find us on Instagram with everyone else. We are enCORE Therapy KC. That is where we are at. Also our website, encoretherapykc.com. I am recently become a blog queen, learning all these blog things. So I've been trying to hammer out a lot of blogs. Blogs are weird, but
yes,
so is Instagram. And I think blogs just are kind of now giving us a little bit more information. It's kind of like, Instagram's just that kind of dangling the carrot, but blogs, I think, are becoming a little bit more informative. And I'm hoping we can get back to that a little instead of such clickbait information. But yeah, Instagram and the website is where you can find us. We have, there's 3 other clinicians on my team, all who are wealth of knowledge, and follow all of us, follow me in general, and just learn about what your pelvic floor is capable of during your perinatal journey.
Amazing. Yes, I actually selfishly will say I have a whole bunch of blog posts that I've been working on. And today I kind of like kicked it off. I was like, I'm going to wait until after this panel that I spoke on this past weekend and have some energy to put towards that. And, all that search engine optimization and all that. But more importantly, it's good information. It's stuff that we need people to know in a way so that you can go through and kind of scroll and find some information that way as well. I always feel so cheesy doing this, but my executive producer will be proud of me for saying, everyone, thank you so much for showing up. Please be sure to take just a moment to go and rate the show, maybe make a comment, subscribe so you get notifications when the new episodes come out. When you listen to the show, it helps us keep going. Sorry for the plug, but also you're here because you like the content. So yes. All right. Well, thank you again, Dr. Beach. So much fun. So great. And for everyone else out there, be curious, not judgmental. Goodbye.